Hey guys, why is it so important to take x-rays if you're dealing with lower back pain? Hey, I'm Dr. Aaron Wall with Gateway Chiropractic, and that's a huge question. If you're dealing with lower back pain, why should you have x-rays? That should be like the first thing that you do. It's very simple. For most people, if you're having lower back pain and it's a chronic problem, it's typically not a muscle problem, it's a structural issue. For instance, a lot of people don't know there's a normal position that your lower back needs to be in, that your spine needs to be in to protect those vital nerves that come out that run your muscles, run your legs, run vital organs. And so if you didn't know this, real quick anatomy lesson, your spine looking behind you, your hips should be level, your lower back should be straight up and down. When you're like that, all these nerves are protected from the side. But from the side, whether you sit or stand, doesn't matter. You should have a 45-degree curve in your lower back. That protects your spinal cord inside the bones, protects the disc, protects the bones themselves. So if you're in the right position, you're not going to be having lower back pain or sciatica, even disc degeneration, that type of stuff, because your structure is stable and strong. It's when we lose that structure, like losing a curve in your lower back, or from behind having the spine bend, sideways. That's when this stuff really starts to creep into our lives and you notice there's a problem there. So that's number one. It's usually a structural issue. But also, you in our office especially, we don't want to guess with your health. We have a big saying in our office, to see is to know, to not see is to guess, and we don't want to guess with anybody's health. So somebody coming in, absolutely, to identify the root cause of low back pain, we're going to take some x-rays. And so I want you to kind of see this in action. So we do digital x-rays here in the office. This is an example of a patient of ours. And, when she first came into our office, lots of chronic pain in her lower back for years. It was even starting to kind of go down a leg. What you're seeing are her original x-rays in our office. And the way we view them, this is her x-ray from the side of her lower back. And you can see how this is where she should be, this yellow arc. But she doesn't have much of a curve. It's very straight. She only has 11 degrees out of the normal 45. So there's a big cause as to why she was dealing with all that lower back pain. In addition to this, when we looked at her from behind, her hips were twisted. As you can see, they weren't level. And then she had this big kink in here in her lower back. And this affects all the sciatic nerves there too. So one of many reasons we identify that. And then part of what we do in the office is we adjust, we do rehab, to retrain the body to get this curve back, to straighten up from behind. By doing that and working on the cause, she gets better and she doesn't have low back pain anymore because she's correcting that problem. So I want to show you guys something here. We x-ray to identify that's huge, but how we x-ray is also very different. So we don't do standing x-rays on any patient. We do seated films, and that's actually unique to corrective care chiropractic offices. And the reason we do that is simple. It's when you sit down, your spine loads differently. There's more stress on it. And when that happens, as a clinician, we can see or identify problems that we compensate for when we stand up. So we'll compensate a lot if we're in pain and we don't realize it. But when you sit down, you take all that out of it. And you can see like ligament damage, you can see bends better. And so we see kind of how your spine is when you're stressing this. So we do that on purpose. The other thing is we don't just take an initial set of x-rays. If you're dealing with lower back pain, we want to check progress. So we do multiple follow-up x-rays to make sure that, if you've lost the curve in your back, for instance, that we're correcting that problem as you're getting better. We want to make sure we're correcting root cause. So I'm sure that makes sense to you. If it does, that just kind of explains how we do things different in the office. But if you're dealing with lower back pain and you want some solutions, give us a chance. We'll take great care of you. We'll really get you functioning better. You can actually click on the schedule my appointment link on next to this page that you're watching this video from. But I tell you what, hopefully that makes sense, and we'll see you in the next video.